Integrative Medicine and Nutrition for Mood and Cognitive Enhancement. Welcome. I'm Dr. Leslie Korn. Let's define cognitive impairment. This is when a person has trouble remembering, learning new things, remembering, concentrating, and making decisions. It can range from mild to severe. Cognitive impairment often begins before symptoms occur. It'll begin in the brain. We know that in terms of food, that trans fats are a major risk factor for cognitive decline. And we know that cognitive decline is subject to lots of misdiagnosis, could be related to mood and cognition challenges that people are having. So really understanding and conducting a solid assessment is going to guide our treatment options. Intensive nutrient support, diet, and exercise can reverse cognitive decline and slow it down during later stages. But most importantly, it will prevent cognitive decline. And in addition to some of our current understanding of vascular dementia or of Alzheimer's disease, there is evidence for a non-inflammatory, low zinc type of influence, and there's even a growing understanding of the role of mold exposure on the nasal microbiome and its effect on brain function. So let's talk a little bit about sleep, circadian rhythm, and mood, because this is a wonderful place to intersect, and it's an area in people's lives that they often haven't been told about. We know that disrupted circadian rhythm leads to mood and cognitive decline. This dysregulates our cortisol, our stress hormones, leading to insomnia, depression, glycemic dysregulation, mood disorders, bipolar, ADHD, bulimia, PMS, and dementia. So there's very little that isn't involved in a disruption of circadian rhythm. If you look at the image in this slide, focus on 6 a.m. and you will see cortisol is at its highest level. Normally, our cortisol should be high when we awaken, and as the day goes on, it should get lower and lower, so that by 12 a.m., it's at its lowest and we're ready to go to sleep and melatonin kicks in. However, under stress, the opposite is true. Under stress, cortisol is very low in the morning when we wake up. This leads to the sluggishness and the fatigue, the low mood that we see in depression. And then by midnight, it's high and someone can't fall asleep. I'm going to share with you some herbal and nutritional approaches to re-regulating this disrupted clock. So what is a protocol for enhancing cognitive function? Huperzine has been identified as a substance from the plant Huperzia serrata. It is an acetylcholinesterase inhibitor. That means it makes more acetylcholine, our memory and learning neurotransmitter, available at the synapse. Acetyl L-carnitine also crosses the blood-brain barrier. It enhances acetylcholine. And it works best, I have found, when it's used as part of a compound to boost brain metabolism, enhance cellular energy, lower insulin resistance. For example, I'll combine it with alpha-GPC and R-lipoic acid. I also like to supplement with yeast-derived RNA, DNA to enhance cognition, memory, traumatic brain injury, recovery from PTSD, and also circulation in the brain. What's next? Join me.